everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be talking about how to manage weight loss in cancer patients. Now, weight loss is a common symptom which we come across in the cancer patients. It is actually the first visible sign which is seen in these patients. Weight loss and undernutrition are the common causes due or because of loss of appetite or even because of the side effects of the various cancer treatments like radiation, chemotherapy, or even major surgeries which they might even undergo. Now, doctors refer the weight loss syndrome generally as cancer cachexia. In my previous videos, we had seen that what is meant by cancer cachexia. However, let's again recap as to what it means. Cancer cachexia is multifactorial. It is not just one sign or symptom which we look at, and that is why we tell that it is a syndrome. A syndrome is means by it is characterized by multiple symptoms. So, what are those symptoms which or the signs which you look at when a patient is having cancer cachexia? It can be loss of muscle mass or what we say as sarcopenia. It can also be a loss of appetite, and due to which it can also there be reduced quality of life. Now we have seen that cancer patients they undergo various treatments like either chemotherapy or a radiation or a surgery. This also has a major impact on their nutritional status as well. So generally we see that these patients come to us with common signs or symptoms such as loss of appetite or loss of taste or alterations in the taste sensation. They also experience nausea, vomiting, or because of the side effect of a particular drug, they also can experience diarrhea as well. Now, during these times, what happens is that yes, they have a loss of appetite, they're not able to eat, and they're not even able to meet up to their actual nutritional requirements, which is needed. During this time, it is very important to modify their diet in such a way that they're able to follow the diet easily, and also it is going to help them in gradually improving their weight as well, because we have seen that when a patient is going to experience a weight loss, a significant weight loss, in fact it is also going to have an impact on their clinical outcome as well, because it is going to also cause chemotherapy radiation induced toxicities more, or what I say as adverse effects of the treatment as well. Hence it is very important to modify the diet as per the patient's current condition. Now, it is also important to understand what are some of the tips which you can take away home in today's session, which will also help the patient in improving his weight loss gradually or reducing his weight loss. Because the thing is, we need to ensure that the body also gets strength so that they can also withstand their treatment as well. What you need to do is, first of all, you need to encourage them to incorporate small frequent meals in the diet, at least at an interval of every 3 hours. Let it be small portion sizes which the patient can easily tolerate, because sometimes what happens is when we give large portions of food, they may not able to tolerate, they again will feel gastric discomfort, or they could also feel that they are not feeling hungry. So rather give them small frequent meals, preferably at an interval of 3 hours, and ensure that they have 5 to 6 meals in a day. Next is you need to encourage them to eat their largest meal when they actually are feeling hungry. This either could be breakfast or even a lunch or a dinner as well. Try and incorporating high calorie foods in their diet. It could be either a milkshake, or it could be any form of a smoothie, or it could be also a protein powder which is incorporated in the form of a milkshake or even as a smoothie as well. Next, it is also important that you include high calorie smoothies, high calorie foods in their diet, and also high protein foods. When I say high protein foods, you can surely include in their diet plant based protein sources like unsweetened soya milk or almond milk, and it could also include nuts and seeds, pulses and legumes, and you can also incorporate A2 milk and milk products if they are very well tolerated. So everyone, yes, it is very important that we also help the patient in not experiencing weight loss. It can be also challenging as well for them to improve their weight, and especially during the cancer treatments we see that they don't feel to eat the food, but we need to ensure to help support them and guide them so that they will also be able to improve their nutritional status, which will also help them in improving their overall clinical outcomes. Thank you for watching my video. We at ZenOnco.io are here throughout your journey to navigate you through your cancer care journey. For further assistance, you can surely connect with our cancer coaches on the below mentioned contact number. Thank you.